Good evening, everyone. So this week we'll have a short video on trichogram. And since we were discussing a few weeks back, we were discussing everything about hair regarding hair growth and cycle, hair histology. So I thought that we'll discuss a small PPT on the trichogram. And this lecture covers the investigation known as trichogram. Okay. So before you see this video, I would request that you go back and see all the related videos on hair. You should see the hair histology, the hair growth and cycle, hair anatomy and physiology, because, so that you can have a certain understanding that what sorts of layers are present in the telogen phase, what layers are present in the anagen and the catagen phase. Okay. If you know what all layers are present in different stages of hair cycle, you can easily understand why telogen hair has a crumpled sock appearance on trichogram and why you have a hockey stick appearance in anagen hair. So you can understand all of these morphological features when you know what exactly are the anatomical constraints of that particular hair in that particular stage of cycle. Okay. So without much further ado, this will be a short presentation and we'll start our lecture on trichogram. Let's move forward. Previously, we have discussed that anagen, catagen, and telogen, these three types of hair exist during the vast expanse of hair cycle. Okay. Now, anagen hair is firmly adherent to the scalp, so it does not come out with least amount of force. You require a considerable force to pull the anagen hair out from the scalp. Okay. Just a second. Yeah, you need a considerable force to remove anagen hair from the scalp. In a process known as anagen arrest, there is a temporary stoppage in the anagen phase. So we know that hair moves from the growing anagen phase to a somewhat resting catagen phase and then a telogen phase in which the hair shaft is it is expelled outside from the scalp or from the skin, and the remaining part, the hair bulb, will start the anagen cycle again. So that is the hair cycle. Okay. So this is a normal cycle, but sometimes when the hair shaft is in anagen, it can undergo an arrest and stop for some time. This is known as anagen arrest, and this is temporary. I'll write here. This is temporary. Okay, temporary. So anagen arrest is temporary stoppage in the anagen phase. Clear? Whenever you see a patient that has inflammatory skin diseases of the scalp, particularly of the scalp where you can find long hairs to pull out, do a trichogram and you will learn a lot about what pathological process is undergoing and is affecting that shaft. Now, when you forcibly pluck the hair shaft, you get both hair, anagen and telogen. Remember, anagen hair shafts are firmly adherent to the scalp, it requires force, while telogen are loosely adherent to the scalp and comes out with minimal effort. So when you use force to pluck out hair shaft, you get both hair shafts, anagen and telogen. And when you look them under a microscope, it's known as trichogram. Okay. Now, telogen hair can be easily pulled out along with hair bulb. Remember, if you try to pull anagen hair and it comes out, the hair bulb will not come out mostly and it's going to stay inside because it is firmly adherent to the dermal mesenchymal tissue. Okay. So if I would like to draw a simple, very simplified diagram of a hair shaft, let me just get some area to draw. Yeah. If you see that this is the hair ostia and this is the hair shaft and this is the bulb, let's just say there. So in anagen, this bulb is firmly adherent. It is firmly adherent to the surrounding dermal mesenchymal tissue. So if you pull out forcibly the anagen shaft, the bulb most of the time is going to stay inside the scalp. But in telogen, this kind of attachment is not present. Okay, in telogen, this kind of attachment is not present. And if you pull it, you will just get the shaft. And the bulb will also come out because this adherence, this attachment is not that strong. So if you pull a telogen hair, you will get shaft along with the hair bulb. So you can easily examine a rudimentary hair bulb when you examine telogen hair. Clear? If there's a problem in the hair shaft, so for example, you have hair shaft disorders, you can also examine the hair shaft in trichogram. So in a trichogram, you can easily see the entire hair shaft or a considerable length of hair shaft and the hair bulb. Clear? Let's move forward. So what is trichogram? And this is the definition of trichogram. So if you want to remember this, or in the Viva you can easily see that what is trichogram. Trichogram is minimally invasive, simple, inexpensive and fast exploration technique that is performed to determine the activity of the hair follicle. So essentially in trichogram, what we are trying to determine? Anagen and telogen ratio. And by trying to determine anagen and telogen ratio, we are just trying to find out whether the follicle or whether the shaft was in telogen phase or in anagen phase. So we are trying to determine the activity of the hair follicle. Okay. The proximal end, that means the bulb and root, if it's attached to the shaft, can be examined, or even the broken shaft can be examined. Okay, so if you pluck it out, there is tension in the hair shaft. Okay, you're plucking it. So if the hair shaft is abnormal, the shaft can get broken and you can see the broken ends. So let me explain it. Let's say this is the scalp and this is the hair along with the bulb. In anagen hair, the bulb is going to stay here only and the hair shaft is going to come out and you can just examine the crumpled end of the hair shaft. So this is anagen. Clear? In telogen, since the bulb has let go of the attachment to the dermal mesenchymal tissue, the entire hair will come out along with the bulb. And you can examine the rudimentary bulb in telogen hair. So this is a telogen hair. Let's say if there is a hair shaft abnormality. So the bulb is going to remain inside and you will have a broken hair shaft. And outside also you will have a broken hair shaft. And you can examine this end, okay, this proximal end, and see what is the nature of breakage of hair shaft. Clear? Let's move forward. So this is a hair shaft abnormality here. Clear? Let's move forward. Let's come to the procedure of trichogram. The site which is usually taken for trichogram is the central area and the vertex for endogenetic alopecia. So most of the time you take from the vertex, from the center, the crown part. The central area and vertex for AGA. If you need a second sample, you can get it from temporal or the occipital area. Other areas, for example, in female pattern hair loss or telogen alopecias, you can have it from different areas in which you want to examine. Let's say a person comes with grade 6 AGA, like I have. If a patient has grade 6 AGA and you would like to examine the hair shaft, you need to pluck some hair shaft. If there are no hair shaft, what will you pluck? So you take it from the temporal area and examine. Okay. If there's female pattern hair loss with a midline recession, you would like to pluck it from near the affected area rather than temporal area, isn't it? If there is scarring alopecia that needs to be examined, so in areas in disorders of scarring alopecia, you need to take it from the margin, from the area of progression, because you need to know the activity. Okay, let's say you want to differentiate between lichen planopilaris or maybe alopecia areata or lichen planopilaris in an endogenetic alopecia patient. So take it from the area in which there is progression so that you can examine the hair bulb and shaft. You take a protected Cocker's forceps. This is a very important quiz question. We use a Cocker's forceps which is protected. That means at the end of the Cocker's forceps, we add a rubber sheath. Okay, we add a rubber sheath so that it is protected. It does not break the shaft. We just want to apply force so that we can pluck it out. We don't want to break the shaft hydrogenically. Okay, you take a lock of 15 to 20 hair about 2 centimeter away from the scalp and then pulled quickly in the direction of hair growth. Now this sentence is very important. In the Viva, if you're going to answer about the procedure of trichogram, you need to mention in the direction of hair growth. So you cannot just pluck it and pluck it like this. If hair is growing, let's say if hair is growing in this direction, the force should also be there in this direction. Okay, the force should be there in this. So you pull it perpendicularly from the scalp. Okay, if, for example, you're plucking it from the temporal area, in temporal area, the hair grows at a very acute angle. It nearly flat, parallel to the scalp. So in this, you put the force parallelly to the scalp. So along the hair shaft, along the direction of growth of hair, you pluck the hair out. Okay, and you have to do it quickly. You don't be a medieval torture specialist and try to pull hair from the scalp. You have to do it very quickly in a second. Okay, then you take those plucked hair and you put it on a slide with immersion oil, put a cover slip and examine. So this is how trichogram is done. Clear? Let's move forward. So this picture, which I've taken from this article, I've put the description in the description of the video. I've put the URL. You can just copy paste and see if you can find the full text and read about it. So you take about 15 to 20 hair in a lock of hair. You use a protected coccus forceps. So here is the protected coccus forceps. Protected coccus forceps. And about 2 centimeters away from the scalp, you grasp it firmly. You put a finger so that you can guide it, so that you are not bending it. You are plucking it on the direction of hair growth and you pluck it quickly. Clear? Let's move forward. Now this is how you mount a trichogram. Okay, you pluck all the hair, you put them parallelly, you put a adhesive tape so that the hair shaft don't get blown away by air or they don't get dislodged while you are mounting. You put the hair shaft on an adhesive tape, you put the tape on a glass slide and then cover it with a cover slip. Okay, so that is how you're supposed to mount it properly. Now remember, you are trying to mount it as parallelly as possible so that in a single field or a single swipe of the view, you can look at nearly all the bulbs and count the number of anagen and telogen here. Clear? Let's move forward. Now, let's study about the features that you see in a trichogram regarding anagen or telogen hair. First, coming to anagen hair. In anagen hair, the stems, the shaft, are longer. The shaft is uniform in diameter and rectangular in shape. So here you can see that it's somewhat a rectangular in shape. Okay. There is a slight distal angle present. So distally, there could be an angle. There is very dense bulb pigmentation along with the sheath. So in the anagen hair bulb, in the anagen phase, you will see pigmentation. Why? Because anagen means growing hair and growing hair means active hair bulb and matrix cells. That means active melanization of hair shaft and you see pigmented hair bulb. Clear? The sheath is also present. Why the sheath is present? Because there is firm attachment between the bulb and the sheath in an anagen hair. So when you forcibly pluck them out, the sheath also comes out. Okay. The Catagen hair is rarely seen in trichogram. Okay. In telogen hair, the stems, the shafts are shorter. There's thickened root with club or coarse shape. So you can see that the hair end, the proximal end is now swollen, it's thicker, it's club shaped. There is not much pigment. Why? Because in telogen hair, the pigmentation is already stopped. There is already destruction of the matrix melanocytes. And a new cycle will begin and a new cycle will start producing color in the anagen phase, but in telogen phase you don't have color. So you see a less pigmented or a non-pigmented hair bulb known as the club shaped hair bulb. Okay, so the hair bulb is thickened, it's club and coarse shaped, there is no distal angle with clear or no pigmentation over the bulb. The sheath is absent or only present in the distal end. Why? Because now the sheath is either destroyed and reabsorbed during the telogen phase, or the sheath is not that firmly attached to the bulb. So when you forcibly pluck, only the bulb comes out, the sheath remains inside the scalp. Okay. The fourth type is the dystrophic hair or pathological hair. In pathological hair, you have a tapering diameter of the hair shaft. So you can see that this end, the proximal end, is thinner as compared to the distal end. Okay, so you have a tapering or a variable diameter of the hair shaft. This deformed contour, the boundary, the perimeter, the periphery is deformed. Sheath is destroyed or absent, and there's a large distal angle. Clear? So let's move forward. Let's discuss each of different hair types in a bit more detail. Plucked and pulled anagen hair. Normal anagen hair is firmly adherent to the scalp and is plucked with difficulty and pain. So when there's pain on plucking, you are actually plucking out anagen hair and that is causing pain. In telogen hair, the hair bulb is already undergoing destruction. The nerve endings are also suppressed. It easily comes out. There is no pain or minimal pain. Okay. The hair bulb is triangular or delta shaped. Okay. Delta means that we know that in normal growing hair, the hair bulb is like this. Very bad. Okay. And this is the attachment of the dermal papilla. Dermal papilla. Okay. When you forcibly pluck out anagen hair, this part will get pulled and you have a triangular end, which is known as delta or triangle. So you have a triangular delta shaped hair bulb. If the hair bulb is soft, that means it is not cornified yet. It's a newly growing anagen hair. So it is bent due to trauma. The trauma of forcibly plucking the hair shaft bends the hair bulb and you get a hockey shaped configuration or a J shaped configuration like this. So at the end, you see a hockey shaped configuration like this. And this is a feature of a plugged anagen hair. Hockey shaped. Clear? The inner root sheath and outer root sheath is seen usually, but it may be left inside, and if it is left inside, it is known as dysmorphic hair. And dysmorphic hair is different from dystrophic hair. Okay, dysmorphic hair means that it is as normal hair, but it is just not growing properly for many reasons. While dystrophic means there is a pathological problem preventing the hair to grow normally. Clear? So the sheath are seen in a plugged anagen hair. Why? Because in plugged anagen hair, the attachment between the different sheaths of hair is very tight. It's very adherent. So when you plug them out, all the sheaths come together. So look at this. Look at the end of the hair bulb. It's triangular. Okay. So from here to here, you can see it's much of a trapezoid or a triangular. That means the proximal end is wider as compared to the distal end. So you have a delta shaped triangular bulb. You can easily appreciate that you can see the ORS, you can see the lighter IRS along with the plugged hair shaft. And if the bulb is not cornified, it becomes hockey stick shaped dysmorphic hair. Clear? Hockey shaped dysmorphic hair, like a stick, like a hockey stick. Let's move forward. Now, plugged or pulled catagen hair. Although they are rarely seen, but we need to learn a bit about it. Catagen hair can be plucked out, but with some difficulty. But usually they come out when a tuft is plugged. Now remember, if you look at the distribution of hair shaft in different parts of hair cycle, generally, you see that most of them are in anagen, followed by telogen, and a very few of them, about 5% to 10% are in catagen. So the amount is so small that you usually don't get them when you are plucking the hair. The findings are similar to telogen hair, except these are the differences. You can see a clear non-cornified sac around the club hair. Okay, because some attachment is still left. It is not completely lost. It will be lost in the telogen hair, and we'll discuss that when we'll come to telogen hair. There's a tail of soft clear tissue below the bulb, which is known as the fibrous connection or a fibrous streamer. Okay, so this is nothing but a degenerated epithelial connection between the shaft and the dermal papilla. So before, when the hair was growing in anagen phase, this was the level of dermal papilla. But during catagen phase, the hair shaft is now smaller. It is pulled up from the deeper dermis to near the papillary dermis, leaving behind a fibrous streamer. So if you pluck the catagen hair out, you can see the fibrous streamer. For more details, I will request you go back and see the anatomy of hair follicle. We have a video on that, and you can easily understand this kind of features of different hair shafts. So look at this from a plucked terminal catagen hair. You see this kind of frayed edges of the hair bulb. You see a non-cornified sac surrounding, which is just made up of the sheath, which is crumpled, and a tail which just symbolizes the perifibrous or perifollicular fibrous sheath, which just comes out because the attachment is still left. That attachment will be lost in telogen hair. Click. Let's move forward. Now, plucked and pulled telogen hair. Telogen hair can be easily pulled and plucked from the normal scalp. They easily come out. They have an expanded, depigmented or hypopigmented club-shaped bulb. So we have discussed that the bulb will be club-shaped. So you see the hair and you will see a non-pigmented club-shaped hair bulb. The bulb in telogen hair is cornified. That means it is hard. So if you pluck them or in the hair and you don't require much force to pluck out telogen hair, there's not much force involved and the hair bulb is also cornified and hard. It does not bend like you see in anagen hair and you have a non-bent bulb. Clear? Let's move forward. Now look at this hair bulb. The end of the hair shaft is destroyed. It's undergoing apoptosis. And you see this kind of, the inorganized appearance. You see a ruffled sheath, which is just a part of sheath which can be seen in the proximal part, not the distal part. And there's a non-cornified sac around it. In terminal telogen hair, you can see that the sheath is lost. Why? Because the attachment between the hair shaft and the sheath is lost. So when you pluck them out, the sheath remains inside the scalp and the telogen hair comes out. You can see a cornified hair bulb which is hard and therefore not bent. Not bent. So it's a straight, not bent hair bulb which is hard. Why? Because it has undergone cornification. Clear? Let's move forward. So let's look at the comparative images. In Anagen, you have a uniform diameter hair shaft, uniformly pigmented. You see a darkly pigmented hair bulb, which is delta shaped or triangular with frayed edges. And you can see the presence of sheath, namely the IRS and the ORS. Okay, and it's a straight shaft, but only the hair bulb is bent, which shows the hockey shaped configuration because of forcefully plucking the hair bulb which is firmly attached to the dermis. While in Catagen, you will see a non-cornified sac around it along with a tail of perifollicular fibrous sheath with expanded frayed edges hair bulb. While in telogen, you will not see sheath. Sheath is absent. Okay, sheath is absent, but since the bulb is cornified, the bulb is not bent. Clear? It's not bent. Let's move forward. Now, this is usually if you have done your trichogram and the procedure correctly, this is how you see a trichogram. Okay. Now, in trichogram, we need to find the anagen and telogen ratio. Okay. So, all the hair I've already labeled all the hair which are anagen. You can easily see that the hair is properly pigmented. There is sheath present around it. In fact, you can easily appreciate the delta end hair, okay, or delta end of the bulb hair. Okay, so these are all anagen hair shafts, but for the ratio you require telogen hair shaft also. So we see that these two are the telogen hair. So can you see this crumpled sheath a bit here? It is anagen growing into telogen, and you can see this kind of straight non-pigmented hair bulb. Okay, so these are telogen hair. So we need to find the ratio between anagen and telogen. So anagen is about 21. You can pause and count it. Telogen is 2. So telogen count is 2 out of total hair shaft examined, which is 21 plus 2. So 2 out of 23, about 9%. Clear? Let's move forward. So whenever you do a hair trichogram, you need to find the ratio and you mention the telogen count. Now, how to interpret? In the previous example, we saw that the ratio, the telogen count, or the number of hair shaft in telogen phase divided by total number of hair shaft examined into 100, the telogen count is 9% in the last example. If the telogen count is more than 20%, that means more than 20% of the hair shaft examined are in telogen phase, we label it as trichogram of telogen effluvium. That means the amount of hair shaft in telogen phase is so high that when you examine them, the number is coming out to be more than 20%. You can have attached keratotic material and scale. So if proximally you see a keratotic scale or material, this can be seen when you're examining hair shafts from seborrheic dermatitis, psoriasis, or in fact folliculitis. It just tells you that some kind of inflammatory parakeratotic activity is going on. Sometimes you may see an associated demodex in Demodex folliculorum. It can be there. Or in fact, in the picture, like I've shown, you can see pediculosis capitis or hair lice or head lice. Okay. So you can see the attached organisms also. So it becomes easier when you want to examine under microscope and you can easily find the cause why the patient is very itchy. Clear? Let's move forward. So with that, we have completed our short introduction to trichogram. This half an hour will easily teach you about the basics of trichogram and how to interpret it. If you want to read more, these are the reading recommendation. In fact, this article is very good. You can just go through it. It's in the description. You just have to copy paste the URL and find the article and read it. Okay. Again, request for the Ruby membership. I won't take much time. If you think that the videos are helpful and they have some kind of utility, do consider becoming a member of the channel. The least you can be a member of is the Ruby membership. And if you can possibly do consider becoming a Sapphire member. Okay, so in Sapphire membership, you get much more benefits as compared to Ruby membership. And if you can contribute by becoming a Sapphire member, that is much appreciated. It gives me more motivation. So without a member. Okay, so in Sapphire membership, you get much more benefits as compared to Ruby membership. And if you can contribute by becoming a Sapphire member, that is much appreciated. It gives me more motivation. So without